How are oral ulcers linked to lupus diagnosis? Imagine having persistent sores in your mouth that just won't heal. These oral ulcers can be more than just annoying. They can sometimes be a sign of a deeper health issue like lupus. Lupus is a complex autoimmune disease that causes your immune system to mistakenly attack your own tissues. Among its many symptoms, oral ulcers are quite common and can be an important clue for diagnosis. In lupus, oral ulcers typically appear as painless or sometimes painful sores inside the mouth, on the roof of the mouth, the tongue, or the inside of the cheeks. These ulcers are usually round or oval with a white or yellowish center and a red border. They tend to be small but can sometimes be larger or more numerous during flare-ups. These ulcers are often recurrent, meaning they come back over time, and may last from a few days to a couple of weeks. The connection between oral ulcers and lupus is significant because these sores are considered one of the common symptoms of the disease. They are included in the list of mucocutaneous manifestations, which are skin and mucous membrane symptoms associated with lupus. According to medical guidelines, about 25 to 50% of people with lupus experience oral ulcers at some point during their illness. These ulcers are usually not caused by infections or other common mouth conditions, but are directly related to the immune system's abnormal activity in lupus. Oral ulcers in lupus are often part of a broader set of symptoms that include skin rashes, joint pain, and fatigue. When a doctor evaluates someone suspected of having lupus, they consider the presence of oral ulcers along with other signs and symptoms. The diagnosis involves blood tests like the anti-nuclear antibody test, which is positive in most lupus cases, and other specific antibody tests. A biopsy of the ulcer or affected skin may sometimes be performed to confirm the diagnosis. It's important to understand that oral ulcers are not exclusive to lupus. They can also appear in other conditions like canker sores, infections, or vitamin deficiencies. However, in lupus, these ulcers tend to be persistent, recurrent, and associated with other systemic symptoms. Their presence can help healthcare providers piece together the puzzle when diagnosing lupus, especially when combined with other signs like skin rashes, joint pain, and blood abnormalities. Living with lupus means managing these symptoms along with other health issues. If you notice recurring mouth sores that don't heal or are accompanied by other symptoms like joint pain or skin rashes, it's essential to consult a healthcare professional. They can perform the necessary tests to determine whether lupus or another condition is causing these ulcers. Remember, oral ulcers are just one part of the bigger picture. While they can be an important clue, a thorough medical evaluation is necessary for an accurate diagnosis. If you suspect lupus or have ongoing mouth sores, talking to your doctor is the best step to get personalized care and effective treatment options. Early diagnosis and proper management can help improve quality of life and reduce the risk of complications.